So for this week's Challenge Wednesday, we have our patient Nadia, and Nadia is a 27-year-old female with an overactive thymus and complains of daily fluctuations and fatigue levels that are highly dependent on rest time. During the examination, the therapist notices the patient walking her hands up her thighs to assume an erect posture. Which of the following findings would provide the most insight into the patient's diagnosis? So we have A, a shock-like sensation during cervical flexion. B, splaying of the toes when stroking the plantar surface of the foot. C, temporary resolution of ptosis after crushed ice over the eyelid for 2 minutes. And D is sensation loss and a glove stocking distribution of both lower extremities. All right, so I know you were looking at this question. Maybe you were hearing me say this question and you're like, damn, that is a lot of information. Yeah, it is a lot. All right, but you need to expect this on your NPTE as well, because not every question is just going to be some 5-word sentence, knock it down. Which of the following is it? You know, sometimes you're going to have these thicker paragraphs, and that's what I'm trying to train you for. All right. Train your endurance level and your ability to stay focused even when the question's a bit longer. Make sense? So let's go up to the top of this one. We got Nadia. Is a 27-year-old female with an overactive thymus and complains of daily fluctuations and fatigue levels that are highly dependent on rest time. Now, there probably should have been a comma in there somewhere. There wasn't. I'm not an English major, but there probably should have been a comma in there. Anyway, let's take a look at some of this important stuff. Okay, 27-year-old female. I want to keep that in my mind because there's certain pathologies, neurological pathologies, that are specific to that age group. Is there not? So I want you thinking about what that possibly could be. That age and that gender is pretty important. All right. One of the ones that I'm thinking about, and of course you can get multiple sclerosis. Of course, that could be a patient who's young like that. It could happen. All right. They tend to be a little bit older, closer to more of the 40 age group. But, in this area, I'm really thinking about myasthenia gravis. Any of y'all heard of that one? Myasthenia gravis? That's one of the conditions where the patient's usually 20 to 30 years of age. It's usually a female. All right. And again, it's consistent with myasthenia gravis. That's going to be an autoimmune condition where the body really attacks at the neuromuscular junction, where the nerves are actually sending their signals into the muscle fiber. Well, there's an autoimmune attack on the receptors that block the ability of the nerves to send the signal to the muscle. And that could be a really bad situation, right? Because then that makes the muscle really weak, and then the person presents with like excessive weakness. All right, so that's just a general baseline of what myasthenia gravis is. But let's go down the line and see if there's more evidence of, it possibly being that. Okay. Here we got overactive thymus, and that's also very consistent with myasthenia gravis, not so much with MS. All right. And you may say, well, what got me thinking about, this neuropathology anyway? I'm really thinking as we look through this question, what type of signs and symptoms are we really seeing? One of the things being this overactive thymus. And I know the thymus gland, when it's overactive, it starts to cause things like myasthenia gravis. Thymus is responsible for a lot of the immune system function. All right. So we can get that autoimmune type condition when we have an overactive thymus. Now, it says that the patient complains of daily fluctuations in fatigue levels that are highly dependent on rest time. That also has me thinking like, it's really interesting. Daily fluctuations in fatigue levels. Ooh, MS possibly here. It's like, okay. I mean, I know that if a patient rests and they have MS, that could make them better, right? But that really helps with a patient with myasthenia gravis, though. All right, so again, I'm still teasing between MS, possibly myasthenia gravis. Let's continue down. It says, during the examination, the therapist notices that the patient walking her hands up her thighs to assume an erect posture. And I'll go ahead and stop there as well. This is important because have you ever heard of somebody doing that? I mean, think about it. Have you ever heard of somebody walking their hands up their thighs to assume an erect posture? If you haven't heard of the Gower Sign, you need to know that for the NPTE. The Gower Sign is exactly what I just told you, walking your hands up your thighs to assume an erect posture. But the reason why somebody does that is because of proximal muscle weakness. Again, very consistent with a neurological pathology. A lot of times you'll see this with Duchenne's muscular dystrophy. Did you know that? Gower sign is very consistent with Duchenne's muscular dystrophy. Okay, why continue down the line? And it says, which of the following findings would provide the most insight into the patient's diagnosis? Now, before we go in and start looking at the answer choice, I just want to recap with the question really quick. We had a 27-year-old female with an overactive thymus. I'm thinking about neurological pathologies right now. Why? Because, well, this question was neurological in the beginning. It was a neurological examination question. You probably saw that when you started downloading the podcast, right? Or when you looked at the title. So we're already thinking in that neighborhood. Is an overactive thymus consistent with Duchenne's? Not really. All right, is an overactive thymus associated with Guillain-Barré? No, not really. ALS? No, can't say that one. All right. How about multiple sclerosis? No, it's not really with that one either. And so we have to really look at this keyword as being pretty important. Overactive thymic conditions are very consistent with myasthenia gravis. So that's how and why I'm thinking that. Right? This daily fluctuations and fatigue levels that are highly dependent on rest time, very consistent with, again, myasthenia gravis. If the patient sits down, if the patient rests, they automatically start to get back a bit of their strength. Now, I'm not saying they turn into like Superman or anything like that, or Superwoman, but they do start to get back their strength. So it's very consistent, again, with that condition. Walking the hands up the thighs, this is really important. So I talked to you all about the Gower sign, right? And we said that that was proximal muscle weakness. Well, not all of our pathologies have proximal muscle weakness, or at least start there. All right, there's a lot of other pathologies that do not. Think about Guillain-Barré. Starts more distally, right, and works its way proximally. Think about ALS. It actually starts distally and works its way proximally as well. And so looking at that, I really am thinking that we're dealing with myasthenia gravis. Does that make sense? Now let's look at the answer choices. The answers are A, a shock-like sensation during cervical flexion. B is splaying of the toes when stroking of the plantar surface of the foot. C is temporary resolution of ptosis after crushed ice over the eyelid for 2 minutes. And then D is sensation loss in a glove stocking distribution of both lower extremities. The reason why I took so long with you all right now in trying to figure out what was the pathology, what are we dealing with? The reason why I did that is because the answer choices are what? They're examination findings, right? So you have to know what diagnosis that you're dealing with in order for you to pick out or anticipate the examination finding. Does that make sense? So let's look at A. A says a shock-like sensation during cervical flexion. Everybody do that with me. All right, flex your head forward. All right, think about that shock-like sensation that you would potentially get. What is that called? All right, in PT school, we always used to mess this name up. It was like Lermit, Hermit, Hermites, whatever. I don't care what you freaking call it. I used to call it Hermit sign. If you want to call it Hermites, you do what you do, all right? But in the text, you will find that the Hermit sign or Lermite sign or Hermite sign is going to be a shock-like sensation during cervical flexion. When does that primarily occur? It actually occurs in conditions like multiple sclerosis, actually. All right, multiple sclerosis, where there's lesions that can affect the brain and also can affect the spinal cord. And when you flex over and you start to tug on those nerves, it causes that electric-like shock down the spine. All right. Am I dealing with multiple sclerosis in this question? Yes or no? The answer to that is no. All right. And so I'm going to go ahead and put an X next to that. Let's look at B. B says splaying of the toes when stroking the plantar surface of the foot. We call that what? The Babinski sign, right? Okay, so that's the Babinski sign. We see this when a child's under 12 months of age, right? So we could see it in that developmental time, underneath 12, but we know that this patient is 27. So why would I see Babinski in a 27-year-old? It would have to be an upper motor neuron related problem. Upper motor neuron. Here's my question to you. Is myasthenia gravis upper motor neuron or is it lower motor neuron? All right, you should be saying that it's lower motor neuron here. All right, it does not affect the brain itself. All right, it does not affect those central nervous system factors. It's more in the periphery. And so what we could do, go ahead and put an X next to that because, again, we're dealing with myasthenia gravis, not MS. Let's look at C. C says temporary resolution of ptosis after crushed ice over the eyelid for 2 minutes. This is actually called the ICE test. It's actually called the ICE test. One thing I need you to write down in your notes that's super important about myasthenia gravis is they actually can get asymmetrical ptosis. Drooping of the eyelid is what that is. All right, drooping of the eyelid. And so they can get asymmetrical ptosis, and it kind of can bounce back between eyes. One time it's the right eye, and the next time it's the left eye that's drooping. So it sometimes can be pretty asymmetrical like that. Here's the deal. When you do the ICE test, that's where you close the eye, put a bag of crushed ice over it, hold it there for 2 minutes, remove the ice, and then have the patient open both eyes. If the patient has a resolution of ptosis that is consistent with myasthenia gravis, baby, myasthenia gravis. Why? Because when you rest the muscles of a patient with myasthenia gravis for a period of time, you will see that there's an improvement in strength. All right. And so temporary resolution of ptosis after crushed ice is placed over the eye. Yeah, baby. All right. I love that as an answer. I'm going to go ahead and put a check mark next to that. Let's look at D. D says sensation loss and a glove stocking distribution of both lower extremities. Well, here's the deal, y'all. Think about sensation loss and a glove stocking distribution. What comes to your mind when you hear that? One of the things I think about is like a diabetic polyneuropathy, right? That's one of the things that comes to my mind. The other thing that comes to my mind is maybe this is what you were saying. It's Guillain-Barré syndrome. Guillain-Barré has that glove stocking distribution that starts down in the lower extremities and tends to wash up towards the trunk. All right. Well, is this patient, Nadia, is she dealing with Guillain-Barré? Do we feel like she's dealing with that? No, there's no signs or symptoms that are really guiding us to that. There's no reason for us to believe that she has diabetic polyneuropathy. And so let's go ahead and put an X next to that. That leaves us with our final answer, our best answer of C. Temporary resolution of ptosis after crushed ice is placed over the eyelid for 2 minutes. Congratulations to those of y'all tonight who got that one correct. I know that one was not easy. You know, this was a multi-part question. Very similar to the type of stuff that you'll see on the NPTE. Not all the time is it just, oh, you have to know just the knowledge. No, you're going to have to be able to diagnose the patient, figure out what the heck the diagnosis is, and then be able to anticipate what you would see on an examination. This is what we call those multi-level questions where, yeah, just knowing one part of it doesn't necessarily get you the right answer. You're going to have to know a bit more than that. You're going to have to take your knowledge to a deeper level in order to get these questions correct. Is that helpful? Is that helpful? All right, so I don't want to just leave you with that, though. I always want to take you to the next level. For those of you on the podcast right now listening to this, first of all, I want to thank you. Second of all, I want to let you know that I always want to take you to the absolute next level with this. If you want a free cheat sheet to help you with this, of course, you can go into the show notes. As always, click the link in there and get it. But now, as of late, we have the ability for you to download every single cheat sheet from the past and even the ones going into the future each week through a Google Drive. So if that's something that you're interested in, go ahead and click the link in the description. You can go ahead and get that and have access to all of the cheat sheets instead of downloading them one by one. Yeah, that's your boy taking you next level. Until next time,